Hi, this is Dr. Farhan. Please watch this video and I hope you like it.
तो डॉक्टर फरहान जावेद, लार्ज वेसल वस्कुलाइटिस के बारे में आप मज़ीद हमें क्या बता सकते हैं? इसकी क्या अलामात हैं, ये किस तरह लाक होती है, हम इसकी तशख़ीस के लिए कौन से टेस्ट करते हैं और इसका इलाज क्या है?
थैंक यू डॉक्टर मरियम। जैसे कि आपने आज देखा कि हमने जो पहला पेशेंट लार्ज वेसल वैस्कुलाइटिस का एग्जामिन किया है और इसकी ट्रीटमेंट स्टार्ट की है। इस बीमारी के बारे में जानना इसलिए ज़रूरी है कि ये एक क़ुव्वत मदाफ़ियत जो हमारा निज़ाम में एक इम्यून सिस्टम है जो हमारा जिसके ज़रिए से हमारा जिस्म बाहर मुख्तलिफ़ किस्म की इन्फेक्शन से लड़ता है। अगर उसमें कोई पेचीदगी या बिगाड़ पैदा हो जाए तो उससे वही क़ुव्वत मदाफ़ियत का निज़ाम हमारे अपने अज़ा के ख़िलाफ़ लड़ना शुरू हो जाता है और उसमें बहुत सी डिफरेंट मुख्तलिफ़ किस्म की बीमारियां जन्म लेती हैं, जिनमें से एक जिसके बारे में आज हम डिस्कस करेंगे वो है लार्ज वेसल वैस्कुलाइटिस, जिसके अंदर हमारे जो शरियाने हैं खून की या ब्लड पाइप्स जिनको कहते हैं, उसके अंदर सोजिश और इन्फ्लेमेशन पैदा होती है और वो मुख्तलिफ़ अज़ा के अंदर बहुत सारी पेचीदगियाँ पैदा कर सकती है। जिस तरह की हमारी जो बिनाई है उसके ऊपर बहुत ज़्यादा कमज़ोरी पैदा हो जाती है और इंसान नाबीना भी हो सकता है। इसी तरह अगर यही सोजिश हमारी उन शरियानों को अटैक करे जो कि हमारे दिल, गुर्दे, फेफड़े या हमारे बाजू और टांगों पे हैं, तो उनसे हमारे इन अज़ा के अंदर बहुत सारी पेचीदगियाँ पैदा हो सकती हैं और ये काम करना छोड़ सकते हैं। और ये एक ख़ुदकार जिसका कोई भी अभी तक ट्रिगर हमें सही से मालूम नहीं है, इसके ऊपर अभी भी रिसर्च जारी है, लेकिन इसके इलाज और इसकी तशख़ीस के लिए बहुत सारे टेस्ट और अद्वियात मौजूद हैं। आजकल के दौर में हम ब्लड टेस्ट और कुछ स्कैन्स हैं, जिस तरह सीटी स्कैन, एमआरआई स्कैन और पेट स्कैन करवाने से इन बीमारियों के बारे में, जिसमें वैस्कुलाइटिस एक है वैस्कुलाइटिस शामिल है, हम मालूम कर सकते हैं। और इसी तरह जब हम इलाज के बारे में बात करते हैं तो हमारे पास अब इस दुनिया में आजकल के दौर में बहुत सारी नई लेटेस्ट अद्वियात, जदीद तरीके की जो अद्वियात हैं वो आ चुकी हैं। पहले के दौर में सिर्फ हमारे पास स्टेरॉइड्स और कुछ अद्वियात जिनमें कॉमनली इस्तेमाल होने वाली अद्वियात में मेथोट्रेक्सेट और लेफ्लेनामाइड और साइक्लोफॉस्फेमाइड वगैरह थी, लेकिन आजकल के दौर में बहुत ही टारगेटेड थेरेपीज़ इन द फॉर्म ऑफ बायोलॉजिकल ट्रीटमेंट अवेलेबल हैं और ये पाकिस्तान में हर शहर में आसानी से मौजूद हैं, जिनसे बहुत अच्छा कंट्रोल हासिल किया जा सकता है और बहुत से अज़ा और ऑर्गन्स के फेल होने से पहले इस्तेमाल करने से बहुत अच्छे रिजल्ट्स सामने आए हैं। और इसीलिए हम तो यही रेकमेंड करेंगे कि इंसान जब कुछ भी अलामात जिनमें सर में दर्द, आँखों में बिनाई में कमज़ोरी, जिस्म में अकड़ाव, स्पेशली अगर आपके कंधों और आर्म्स के अंदर, आपके बाजू में अगर आपको भारीपन महसूस हो और जिससे आपको लगे कि आप रूटीन के नॉर्मल काम नहीं कर पा रही या कर पा रहे हैं, तो आपको अपने फिजिशियन या लोकल डॉक्टर को दिखाना चाहिए, इससे पहले कि आपके अंदर के जिस्म के मुख्तलिफ अज़ा इस बीमारी से अफेक्ट हो चुके हों, जिसके बाद इलाज मुश्किल हो जाता है। सो दिस इज़ ये हमारी आज का इंट्रोडक्टरी सेक्शन है ऑन लार्ज वेसल वैस्कुलाइटिस, और इसके बाद हम अगले सेशंस में बात करेंगे खुदकार निज़ाम और इस I'm one of the rheumatology consultant and internal medicine physician working here at University Hospital Leicester. Today we are going to review a case of giant cell arteritis who is recently diagnosed on the basis of temporal artery biopsy results. Mr. Paul is with us. How are you, Mr. Paul?
Fine today, thank you.
Right. So remember we started you on trial of oral prednisolone a couple of days ago when you were here with your symptoms of... can you tell us a bit more about your symptoms of presentation when you came in with...
The first visit to the GP, if you like, going back.
Yeah, first visit to the GP or when I first saw you here.
Initially it was just a headache, but not a headache as described on the website or anything else to do with that complaint.
Mm-hmm.
It's a headache there on your scalp, pain anywhere on your head, but mine was just above my eyes, more of an eye ache if you've not been to bed for a couple of days or an early flight or whatever. Eye ache. Took paracetamol, which you do, went to see the GP. I thought my blood pressure must be high because years back I had a high blood pressure and headaches. So the GP blood pressure was high and they sent me to the GP AU department, and from then on all the testing, etc., blood tests, they ruled out everything else apart from that one.
When we saw you first, we noticed that your inflammatory markers in your blood test were raised.
Yeah.
And we requested a temporal artery ultrasound, a jelly scan of your blood pipes.
Correct.
That did not show any inflammation, but your blood markers were raised.
Yeah.
Based on that results, we asked for you to have the temporal artery biopsy.
Correct.
And I will explain you the results of the temporal artery biopsy today.
Yeah.
The histological report. But briefly telling you that it has confirmed an inflammation in the blood pipes suggestive of the condition we are treating called giant cell arteritis.
Yeah.
It's an inflammation of the blood pipes, mainly involve the large vessels, namely the aorta and the vessels around the bigger branches of the aorta going towards your arms, your neck, head, and it also affects the blood supply of the back of the eye. So it can threaten your vision if it's left untreated.
Right.
Today we are going to make a change in your treatment based on your biopsy results. So we are going to initiate a disease-modifying anti-rheumatic drug as a steroid-sparing agent, which is called a tablet called methotrexate. It's an immunosuppressive medication which will help calm down the inflammation in your blood pipes, and it will also help us quickly taper you off the prednisolone, because we don't want you to stay on the prednisolone for too long because of the side effects of the steroids, right? If you have any questions, I think I gave you a booklet to read in the last consultation about methotrexate. Have you had a chance to read it?
Briefly, I've got a few questions about possible side effects.
Yeah, feel free.
That's the one.
Yeah, that's the one, methotrexate.
Don't want to go through them now, or?
I mean, if you have any concerns, yes, you can.
Well, what I'm going to ask is, you get the blood test every 2 weeks.
Yes, so...
is that ongoing, or is it just the first 2 weeks?
For the first 6 weeks, you will be on a fortnightly blood monitoring. It's just to see that your blood test remains stable. And once your blood tests are stable, and you are on a stable dose of methotrexate, we will loosen up the blood monitoring to a monthly, and then after a few months to a 3 monthly blood monitoring.
So is this drug on for life, or is it just a fixed period of time? Or does it care about the testing that comes along?
Right, good question. So what we normally see in patients of giant cell arteritis, we start the disease-modifying therapy alongside the steroids and try to taper off the steroids on one side and keep that disease-modifying therapy for a longer period of time to see if there is no further relapse or flare-ups happening in the next at least 12 to 24 months.
No, it's that long.
4 months.
No, it's that long. Right.
So realistically, you're looking at around 2 years' time at least on this new tablet, and once you remain completely stable and off any steroids, no flare-ups happening in the next 2 years, we can consider reducing the dose of methotrexate and finally maybe stopping it. If you develop further flare-ups on this tablet and while being on steroids, the next line of treatment will be a special treatment called biologic therapy, which comes in the form of tocilizumab. It's an injection treatment that we can use and escalate your treatment depending on your situation. If the disease is well controlled with the methotrexate, and a small dose of steroids, or maybe without steroids, we are happy to leave it with this.
So when you say flare-ups, what does that mean in actual real terms?
So flare-ups means
Mainly due to the blood test.
So we can monitor your disease. Number one, you need to understand the disease etiology, or the basic process of the disease.
Yeah.
In this disease process, there is no bacteria or virus as a culprit. It's your own immune system attacking your blood pipes, the large vessels of your blood pipes getting inflamed. And when I say that, it means that there will be no treatment as such to cure it. We cannot kill the bug, we cannot find the reason of your disease. So all we can do is to keep your disease under control, right? That's our target.
Yeah.
So there is no cure, but we have to keep your disease in remission as long as we can, right? For that, we need to give you either some sort of a treatment which can modify your immune system so that to avoid it misbehave, right? Keep it under control. And the way to do it is to either try with the steroids or the tablet that I'm going to suggest you now called methotrexate, or the biologic therapy, which is a third line of treatment called tocilizumab injection.
That's if it's failed.
Yeah, if these therapies fail, then we'll step up your treatment to a next line called the biologic therapy.
That's injections.
Yeah, that's an injection treatment. Any other questions?
Not really. No, that's
fine. So with the methotrexate, I'll briefly tell you a few things that you need to be aware of. It can cause sometimes small ulcers in your mouth, some stomach upset that you can notice when you start this new tablet. To avoid this happening, you can use some tablets called folic acid, which is a vitamin tablet, but not on the same day, any other day of the week. And you can use it up to 5 times or 6 times per week, but not on the same day with methotrexate.
no.
This will help you control the side effects of the methotrexate.
Okay.
Why we are doing the blood monitoring? Because this tablet can affect your liver, sometimes your kidneys, and your bone marrow, because it's all immune modulating drugs. So we need to keep an eye on your liver function, your full blood count, and your kidney functions while you are on this treatment. It can also rarely affect your lungs and other organs, but it's very, very rare. So advice for you to be aware is that in case if you develop any infection while being on this treatment, like let's say you develop fever, your sore throat, or any problem with your waterworks like a urinary tract infection, you need to call the rheumatology helpline immediately and stop taking this tablet and go to see your GP so that you've been started on an appropriate antibiotic cover. You are at risk of, you can say, a higher risk of infection when you're on this treatment.
Does that mean mixing with people with infections on a bus or in the street or in the cinema, for example?
Good question.
You've got to be careful on that one?
You need to be careful because you are slightly, as I said, at a higher risk of catching an infection. But it does not mean that you cannot mingle or you cannot socialize. You can, with the normal precautions, like you can.
Normal for children and whatnot. Okay.
Any other questions or concerns for me?
Not really. I'll look through it again. It's all pretty clear. But this is not an NHS booklet, is it?
This is a booklet from Versus Arthritis website, which is funded locally as well as from our British Society of Rheumatology as well.
Oh, okay.
The safety advice for you with this condition is that if you develop any new visual symptoms, you need to come and attend the eye casualty straight away. As I explained to you already, this is a sight-threatening condition, and if you lose the vision, it can be a permanent loss of vision. And number 2, if you develop any recurrence of your headache, jaw pain while chewing, or any problem with, like in your arms, you're feeling crampy, then you need to contact the rheumatology helpline.
Does that happen all of a sudden, or is it a gradual thing, or does it come and go, those sort of things?
It's normally, the visual problem can be sudden, but all other symptoms are normally progressive and they are gradual in onset, and they can progressively getting worse, like your headache, jaw pain, and your crampiness or this achiness in your arms.
If you got it, it's there. It doesn't go away.
Yeah, if they are being treated timely, then you can recover from all other symptoms.
Okay.
Yeah, and you do not need to stop the steroids abruptly. because you're on a high dose of steroids and you're at high risk of withdrawal, and we in medical terms says Addisonian crisis. If you stop steroids quickly, you will develop some vomiting, nausea, abdominal pain. These are the symptoms. So you don't, if you're running out of the steroid supply, contact us or your GP well before the time, okay?
Yeah. The call from the GP this morning, not the pharmacist this morning, it asked me to need a top up. But going on the top up on the list you made originally, all the way down to 1 tablet a day in October.
Yeah.
But today was the last day of the 10 tablets a day.
Yeah.
Tomorrow it starts 8 for 2 weeks, 6. Is that still?
Yeah, it's still the same. So you will be on a tapering regime of steroids. You will take 50 milligram for 2 weeks, which is 10 tablets. Then 8 tablets, which is 40 milligram. Then you will take 6 tablets, which is 30 milligram.
Yeah, is that still correct?
Yeah, this is the same regime. This is a BSR, British Society of Rheumatology, recommended regime for any patient who's been diagnosed with giant cell arteritis. You will start with the methotrexate 10 milligram once weekly for
10 milligrams?
Yeah, once weekly for a couple of weeks, and then once you tolerate this tablet, you can go up to 50 milligram once weekly.
Really?
Okay. And with this tablet of steroids, you should be on the tablet called alendronic acid, which is a bone protection tablet. I hope you're taking it.
Yeah.
And you're taking a stomach protection tablet.
Yes, I am every day.
Fine. With the steroids, you need to be careful, as I already explained, you need to be careful with your blood sugars and blood pressure. You need to check with your GP for a regular blood pressure and a blood sugar checkup.
I've already been diagnosed with diabetes 2
Yeah.
on Thursday.
This is because of the steroids.
It's just gone over the edge.
Yeah, so as I said, steroids can increase your blood sugars. So you need to liaise with your GP so that your blood sugars should be monitored regularly and your anti-diabetic medications should be...
I'm not on medication, it's just I saw the dietitian and she said, just look at your diet.
Fine.
You don't need any tablets or anything else.
I hope with reducing the steroids and reducing this new tablet, you will get rid of the steroids and you will stay off any anti-diabetic medication, and diet modification will be good enough for your management of diabetes. But in case if your blood sugar level stays on a higher side constantly and you feel like you have to go to the toilet too often during the night, probably that is a time when you need to see your GP and start an anti-diabetic medication.
Right.
Okay.
So remember that the present regime of these tablets is as it is on there, that's safe.
Exactly.
It's safe
as
level.
it is as it's written there on the regime.
Okay.
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 So what do I need to add? This method, what's it? That's 1 week.
Yeah, that's once a week. You mind if I can quickly examine if you can go onto the couch?
Yeah.
Examine you. So,
Put the coat off.
yeah, you can take the coat off. Examine you. With giant cell arteritis, it's a large vessel vasculitis. It can affect multiple organs, as I explained to you. Any organ which has a blood pipe can be inflamed with this condition. But commonly, we see that the large blood pipes running through the neck, supplying the blood towards the head, they get inflamed. So what we are going to examine if there is no drury, carotid drury, which is one of the signs of inflammation in the blood pipes. Okay, so you need to relax, look at towards the wall, take a deep breath in.
The ultrasound scan was negative, as you know.
Yeah. Take a deep breath in and hold it for a second, okay? Good. Now you can relax. Now look towards me. One more time. Yeah. That's alright. We can relax 1 second. Now we're going to examine your heart for any more murmurs or anything. So just breathe normally. Can you turn towards the left side? Yeah.
Like that?
Yeah. Deep breath in and hold it for a sec. Good, Mark. Now you can relax. I'm going to check the pulses in both arms. Now just keep it there. So just for any radio delay, and if there is any involvement of the blood pipes supplying your arms, you have a good volume pulse which is regular, and there is no radio delay. Good. You can come forward. If you can take the glasses off, I just want to palpate the temporal arteries. No pain when I'm
No, never had a pain. Never.
Okay. Now?
No.
Okay. Thank you. All done. Fine, you can come on this. Questions or concerns?
The only concerns are this new tablet, all the side effects in that booklet. They're the only concerns I've got because I've never seen that before, all in one place.
Yeah, I can understand your apprehension about it, but it's just that when you will start this tablet, it's a very safe tablet. We commonly use in our rheumatology patients.
Right.
Though there are a lot of side effects mentioned, but the frequency of this is very rare and very less. I hope this will not be the case with you. But if you develop any side effects, you feel free to contact the rheumatology helpline.
Yeah.
Okay.
Okay.
And we are recording this video with your consent.
Yes.
If you have any other issues or objections, you can let us know.
I will do, but it's okay for now.
Yeah. Thank you.